Alrighty, guys. So this is going to be the chapter 12 learning objectives. These learning objectives are actually your bonus assignment. It is a bonus assignment, guys, but it's super easy. It's going to help you study, and I'm basically about to give you all the answers, so there's no reason not to do the bonus assignment. So yeah, make sure you do your bonus assignment and turn that in by March 2nd at noon. So make sure you guys get that done. This is the last chapter that's going to be on the midterm. So for the midterm, I believe it's going to be chapter 1, chapter 2, chapter 3, 4, 8, 10, 11, and then this one, which is 12. So make sure you guys are studying for that. It's next Wednesday, Thursday, I believe, that you guys can go in and take it. So make sure you're studying and make sure you do your bonus assignment. Super easy, helps you study, no reason not to do it. You're about to get all the answers for it, so make sure you get it done. Okay, number 1, it says categorize abdominal organs to the quadrant they belong in. So the right upper quadrant, you've got the liver, the gallbladder, and the right kidney. The left upper quadrant, you've got the stomach, the spleen, the left kidney. The right lower quadrant, the appendix, and the left lower quadrant really has nothing that's dedicated just to that. In all the quadrants, you have the colon. The 2 upper quadrants, you've got the pancreas. In the 2 lower quadrants, you've got the small intestine, the ureters, and major arteries and veins. So make sure you guys can categorize the organs and where they belong. Whether it be right upper, left upper, right lower, left lower, just the upper, just the lower, or all the quadrants for your test. Number 2, it says briefly describe some of the diagnostic tests utilized for the digestive system. There was a bunch listed on the PowerPoint. So some of the ones that you most definitely need to know, the barium test. Those are when the barium solution, the patient either swallows it or it's put into the colon with an enema. And this test is used to detect lesions in the colon through radiographic tests. Then you've got blood fluid tissue test, a digital rectal exam. That's when they palpate for an enlarged prostate. Endoscopy, they use a camera to check the upper digestive system. Colonoscopy, the camera is used to check the rectum, colon, and lower digestive system. And then it had listed some radiographic and imaging tests, so an angiography, PET scan, CAT scan, MRI, ultrasonography. Let's see. All right, so number 3, it says for the following pathologies, discuss all the details, and the only thing there is TMJ. So the etiology for TMJ, this can be caused from the removal of teeth, arthritis, muscle spasms, teeth clenching at nighttime. Signs and symptoms, make sure you guys can list a few signs and symptoms of TMJ. You've got facial, neck, and jaw pain, stiff muscles in the face and neck, limited ability to open your mouth, and painful range of motion, and then that clicking and grinding sound. On the prognosis, TMJ could just resolve completely, or the patient can be left with chronic pain in that facial, neck, and jaw area. Medical interventions, you can have surgery done, braces from a dentist, a soft food diet, and then there's medicines that can be prescribed to help with pain and other muscle spasms. The PT intervention for this, it's kind of on the PowerPoint. It's just a specialized area, so there's nothing specific you guys need to memorize for PT for these patients. Number 4, it says briefly list and describe some digestive pathologies. Once again, there was like 5 slides worth of pathologies. Just know some of the main ones and be able to break the words down. Like if it's one that you didn't specifically study, you should be able to look at the word and tell. So if it ends in itis, you've got inflammation of whatever. So gastritis, inflammation of the stomach, gastroenteritis, inflammation of the stomach and intestines. Appendicitis, the inflammation of the appendix, Oh, there's all the itises. Yeah, okay. So then you've got celiac sprue, which is this small intestine malabsorption. And this comes from intolerance to gluten. So make sure you guys know that the celiac sprue is connected to gluten intolerance. A hernia, the protrusion of an organ through the wall. Hemorrhoids, you've got nodules of veins at the end of the rectum that can become inflamed. Yeah. So I'll go with that. Make sure you guys look over all of the pathologies. I'm not going to read every single one in the definition to you from the PowerPoint. And make sure you just know some of the main ones. All of them are super easy. You can look at the words and break them down. So that'll be easy for you guys. Number 5, discuss how medications can affect the liver. So the liver is responsible for detoxifying the blood. So if a person is frequently using medicines or overusing medicines, it can end up causing severe liver damage in the long run. Number 6, it says briefly describe some of the diagnostic tests utilized for the urinary system. So there's blood tests, which there's 2 different ones. So a bun test measures the levels of urea and nitrogen, and then the creatine clearance is going to measure kidney function, and it does this. It shows if a kidney can remove creatine from the blood and excrete it in the urine. You also have urinalysis and urine cultures. Catheterization. This is done if the patient can't void their bladder on their own. The cytoscopy, you've got the scope that they put through the urethra to view the bladder for that diagnostic test. Number 7 is a few definitions. Once again, with the definitions, guys, you guys should be able to look at the words and break them down using your midterm. So hematuria is blood in the urine. Pronuria is protein in the urine. Anuria is the inability to urinate. Dysuria is painful urination. Nocturia is nighttime urination, which disturbs the sleep. And then oliguria is the reduced urine output. And then number 8, last one. This is a really short chapter, short learning objective, super easy, guys. Once again, no reason not to do your bonus assignment because it probably will not take any time at all. Urinary pathologies. Once again, there's like 4 or 5 slides listed with these. I'll just hit on some of the bigger ones. You've got a urinary tract infection, bladder cancer, kidney stones, renal failure. Make sure that you guys know with renal failure that it's going to be a filtration rate of less than 15 milliliters per minute, or it's like 1.7 meters squared. Yeah. And the normal is 90. So if a person filtration rate is less than 15, then they're considered to be in renal failure. Wilms tumor, it's a childhood tumor. It's genetic, it's malignant, and it can involve one or both of the kidneys. Renal carcinoma, it's only 2% of the cancers in the United States, so it's cancer. Let's see. That's it. That really was a short one. Okay, guys. So yeah, chapter 12 is the very last chapter that's going to be on the midterm. So make sure you guys are going back over the learning objectives, and answering any questions that you got wrong or that you didn't answer the first time. Looking at your quizzes, making sure you can answer those questions still and correctly answer the ones that you got wrong. And make sure you guys don't just know the answers, know why they're the answers, because they're most likely not going to be asked the same way, but you're going to be asked a similar question. So don't just memorize answers to quizzes after you miss them or after you get them right, because they may be asked differently. So make sure you understand why. Alrighty, guys, I will be starting hopefully the next chapters I'll be able to finish throughout this week. It's not as hectic as a week as it was for me last week, and I got kind of behind. So I'm hopefully going to have the rest of the learning objectives up within the next week or two. So you won't have to wait till a few days before the quiz to take a look at them. All right, guys, good luck on your midterm. If you have any questions, my email is attached to chapter 1, or you can get with Crystal or I, or Michelle, and we're more than willing to answer any questions you guys have. Good luck.